And welcome to DSTC for this new student orientation. And I believe this session is going to be quite insightful for you guys. Just give me 1 second, guys. I'm going to just give me 1 second. Yeah. Okay, so as you know, this is a completely reformatted course now. So we have combined all the exams that you guys need to prepare for, right? I mean, like in North America, which includes AFK, ADAT, and the INBD. This course would cover all of these components, so you don't need to go anywhere else for anything else. We have integrated the syllabus for all these exams all together. Okay, so you got nothing to worry about. So that's the first highlight I want to have you guys oriented to. So as we move on, what am I going to talk about today? So I'm going to be talking about all these things. Some of the things you may know, some of the things you may know, but you are not 100% clear. So I'm just going to clarify some of these points. And after I'm done with what I have to talk about, Dr. James will be logging in, and he will be doing his part of it. And then Dr. Sagar will be logging in. Dr. Abhishek is not in town, so he is not available today. But otherwise, we are going to, I mean, we three are the instructors who are going to be here today to orient you into this course. Okay, so I'm sure when you kind of read these topics on your screen right now, these are things which I'm pretty sure you guys are very much interested in, right? So what are the pathways to dentistry in Canada and in the US? I mean, there's always, I mean, the debate about, I mean, doing direct licensing or should I go to university type of thing. And what are the some recent changes that have happened, and certain preparation strategies as well modifications, as well as the course outline. Okay, so these are the things we're going to be talking about. First up, before we do anything, you guys are dentists, overseas dentists, right? So first of all, let's look at some data on whether it's worth pursuing dentistry in Canada, right? So first, that's very, very important, because you have come into a country where there are a lot of other opportunities. You can do many other things to survive, not just survive, and also like thrive, right? So you don't really need to be a dentist here. However, if you do, you need to kind of do that with some background info. Is it worth doing it or not? Let's check that. So guys, let's face it, okay? I mean, anybody chooses, I mean, a profession mainly on the basis of whether I like it or not. That's very, very important, because if you don't like it, I don't think you're going to do it. And then next important thing is what are the financial returns from this profession as of now? This is something very important. What's the point in going through all these examinations, and if you're not making enough? That makes no sense, right? So let's look at some data on average Canadian incomes. So if you see here, the average Canadian salary is about $1,215 and I don't know 0.2 cents per week, which adds up to a total of $63,181.04, right? So that's the average Canadian individual income. And if you see, if you are making over 100,000, it is not common in this like in this country for one single individual to make that 100K, right? It's not super common. So as a combination, as a family, I mean, a family might be making over 100,000, but as an individual making 100,000, it's not common. As you can see, it's well below that figure here. Now, if you look at numbers for dentists, that's significantly different. Now, I can tell you, you can see this, the average dentist salary in Canada is about $206,945 per year, which is approximately 106 per hour. Now, if you look at entry-level positions, it's 125, and experienced people make more than 227, 367. So as you see, these are big numbers, and I can tell you these numbers are very less. I can tell you that, particularly if you get yourself acquainted with really kind of revenue generating procedures, which, like, let's say if you're good at molar endos, if you are good at oral surgery, if you're good at orthodontics, anything like that, cosmetic dentistry, if you're really good at at these type of work, which is not uncommon. I mean, a lot of dentists, even though they have no experience, they attend CE courses, and over time, they really get good at these kind of stuff, and they start making much more. So a lot of dentists make over 500,000. A lot of them make 800, 1 million. I mean, you have no idea. And I mean, particularly when you have your own, I mean, practice, I mean, things are under your control, your income can really go up. So, I mean, like, the bottom line is, I mean, why am I talking to you? Because this is necessary, right? I mean, like, think about it. You're going to get into a big journey here. So it's important to understand that the fruits at the top of this tree are really what you want. And I can tell you with full assurity that, this is definitely still a financially lucrative profession. Yes, you must have heard that, oh, it's getting saturated. This is getting saturated. That's getting saturated. Guys, of course, if you go to any country, you go to the big cities, in any country, there are a lot of people living there. There are a lot of dentists living there. One could say there is like saturation and all that. But this is a vast country, and the population and is kind of growing here. So, if you're, I mean, particularly once you get your license, if you're willing to step a little away from the city, I mean, like, Dr. Sagar is going to be talking to you about that a little bit. He stepped a little away from a GTA, and he's very happy. And he's going to be talking to you about that. So if you're willing to kind of step out a little more, little far, not so far, so to speak, you can still be living in a very nice town and a very good lifestyle. It's just that if you're willing to step away from like the GTA, any spot that's in the middle of the city, like Vancouver or any big city like that, if you're moving a little away, I think, I mean, the prospects are like amazing. Okay, like really amazing. And apart from that, for somebody, I'm sure there will be a few people here who might be thinking, dude, I don't have much of experience. I just like finished my dentistry and I finished my internship or whatnot, and I'm here and I have zero experience and I don't know what the hell I'm going to do, right? So for people like you, there is ample opportunities in certain remote locations. Like, I mean, there are certain Indian reserves. There are certain locations which are up north, where honestly nobody wants to go to these places because it's away from the city and all that. But if you're willing to clock like a year, two in these places, you will not only make a lot of money, you will also gain significant amount of experience. So you just have to, like, you shouldn't be thinking, hey, I'm going to finish my license and I'm going to sit in Mississauga, I'm going to sit in Brampton, I'm going to go to Toronto. Like, if you're willing to, as I told you, for the ones without experience, if you're willing to go a little away, like, you can make maybe twice or thrice, the numbers that you're seeing here. I'm not exaggerating, okay? Anyhow, so as the point about income is out of our way, it's still worth it. Let's move on to the next step, right? First, we need to, so there are 3 ways to do this. So you can do direct licensing, which you're going to do the AFK, followed by the ACJ, and followed by the NDEC exams, which includes like a clinical skill assessment and also a situational judgment exam. Okay. So now this AFK, as you know, is applied theory, right? So it's not going to be very theoretical. It's going to be applied, very applied. Applied clinicals mainly, and some a basic science component involved. MCQs, so that's basically what it is. And ACJ is more like, photographs, clinical cases. It's more kind of clinical, so that's ACJ. And again, clinical skills is you basically are working on plastic teeth. That's one component, and your accuracy should be very high in order to pass this exam. And then the situational judgment exam involves actors. So you're going to have like a room, and you're going to have an actor sitting there, and you're going to be facing situations, and you have to deal with them. You have to talk to them. You have to write notes. You have to write a prescription, things like that, right? So what I'm going to tell you right now is don't go ahead of yourself. Don't worry about, for the skills, so what should I do? For this the kind of judgment, what should I do? Don't worry about those things. Right now, you worry about AFK, ADAT, and IMDb. Don't worry about anything else, because when your focus is on one spot, you will always have success. So I just the one thing I want to kind of tell you is in order to do this exam, all these exams, I would say at this time, you should be, I mean, like the funds required could borderline $40,000 to $50,000. So in order to kind of write these exams, that includes kind of materials and like buying the stuff for your exams. I'm not talking about AFK, I'm talking about the entire process here. So finances, you got to be clear about it. It's not like if you direct licensing, you save money, you still have to be spending $50,000, $60,000, like I'm assuming you're going to pass it in the first couple of attempts. Okay, so it is an expensive, way to do it. So next is that's basically direct licensing, right? So you pass these exams and then you take the OSCE exam, which is like the provincial. It's not the provincial, it's basically the national exam to get your license. And then you get registered in one of the provinces and you can start practicing. The other option you have is to go to a dental school, either in the US or in Canada, right? So this involves taking the ADAT exam at this point. Most universities have, like, in fact, by this year, I think all universities have, shifted to the ADAT route. And some of the universities in the States still accept ADAT. That number is very little, not many. In the States, most schools are accepting the INDB exam, right? So you got to do, if you want to, long story short, if you want to go to school in Canada, you take ADAT. If you want to go to school in the US, you do the INDB, right? So you finish that exam and then you apply for it, and then you get an interview call. Some schools also have like little clinical skills assessment, which DSTC provides you training for, and then you get selected, right? That's how it goes. A lot of students ask, okay, how do I get called into a university? So I wanna tell you something. Let's not worry about all that too much today. I'm gonna keep it simple for you. There are a few things that are under your control, and there are a few things that are not under your control. Now, the way universities accept students in Canada and the way the schools accept students in the States is very, very different. It is not the same, okay? So in Canada, it's pretty straightforward. So there are, like the three kind of relevant things that they look at is, number one is your ADAT score. ADAT score is key, very, very important. The next important thing is your English score, the IELTS exam or the TOEFL exam or any of those exams that you're going to take. Now, people think that the score that the university has put on their website, they say 6.5 or 7 or 6, whatever. But what we've noticed is when it comes to a tie between two students, let's say there are like two students who have equal, somewhat same scores in ADAT, and one of them has got a higher score in their English exam, they have a tendency to get accepted. So the English exam is very, very important. You have to do well in that. And I'm going to say the most important component that they look at in these English exams is the writing, which is what people suffer. Like, academic writing is not easy. Even the ones who've got, like, let's say I've done IELTS, I have experience with IELTS. I can tell you, a lot of people get 8 on 8 in speaking and reading and all that. But when it comes to writing, they struggle to cross 6.57. Like, that's average. So you need to go 7 and over, in writing if you're doing IELTS, and something proportional when it comes to the TOEFL exam. So the English exam is very, very important. So the ADAT exam and the English exam are two things that is under your control right now. Now, certain things have already slipped by you, like example, your university back home, BDS or whatever course you did, the scores you got in those exams, right? Your percentage score, your GPA back home. That's very important in certain universities. Now, if you have not, it's not like if you have not done very well, they are not going to accept you or anything like that. But definitely it is something that can matter. But let's say you're able to compensate that with a high ADAT score and a high English score, you will still thrive. So, in order to be called for an interview, Canadian universities really don't look at anything more than this. They don't care about whether you've done your master's. They don't care if you have published papers. They don't care if you have if you have given scientific presentations. They don't care. I'm again saying it with an underline. They don't care. Okay. So in fact, certain universities let's say, the University of Toronto, we've kind of come to realize that they're staying away from people like that. It's funny, but that's what's happening, because some of these people who enter the program, they come to the clinic and they are like trying to teach the instructor themselves, because they know more, like they've done presentations, they've done masters, so they've seen that happen over the years, and they don't want to take them, right? So if you are applying to any Canadian university, I would encourage you not to really highlight anything outside what I've told you, which is basically your ADAT score and then your English score, and of course your BDS transcript. Don't really worry about anything else. And so these are the three criteria. Now, US schools is a different story. Okay, completely different. So now, if you go look up their website, they want letter of recommendations, sometimes more than one. If you've done scientific papers, that helps. If you've done masters, that helps. And again, US has tons of universities. They have a lot more number of universities than in Canada. So you have to look up individual requirements there. And again, as you are aware, the INDB exam is a pass or a fail exam, right? So they cannot really say, I don't know, they might be sending scores to the universities, but as far as my knowledge goes, I don't think they look at the IMDb scores. They don't really care about that. So that's a pass or a fail. So, other things, like the things that I told you, of course, English is going to matter in any of these countries. And I mean, like in the States, if you have done some paper presentations and et cetera, all those things that Canada doesn't care about, the US schools do care about it, right? And also you have like dental specialty. So that is also now, although it says DSCKA on the slide, it's also based on ADAT. So I want to first rule this thing out. I'm not in the classroom, so I don't know who's a specialist, who's not. It's fine. So I'm sure there are a few people who have done their a master's program and all that. I want to just tell you something outrightly. This thing is, you can rule this out. Okay, this is most likely not going to happen. So if you go look up universities, very few universities consistently take students under this program. And I mean, the UFT has one seat in orthodontics, and I've had some people getting accepted there, like one a year, and a lot of people apply. And the other specialties, other universities, I've not really heard of it much. That is something I would not rely on. Of course, you can apply on the side, because you're going to take ADAT anyway. And if you have an opening for your specialty, and if you're interested to pursue that, you apply it, but you don't rely on it. You don't sit here hoping for that to happen, right? If that happens, great, that's a bonus. But the odds of that happening is very low, because you have very little number of seats, right? So the next burning question that many people have is, okay, should I go for this AFK, ACJ, the equivalency process, or should I actually attempt going to school? Now, a common notion is that people think, okay, if I have a lot of experience from back home, I would rather do the exams. And if I'm not having enough experience, I'm going to go to school, right? That is what generally people think. Now, I'm not saying that's wrong. I believe that experienced people can also gain from universities, and inexperienced people also pass the equivalency process. I again kind of repeat that. A lot of inexperienced people pass the equivalency process. So equivalency process is a bunch of exams which you can prepare and anybody can pass. And after that, you can take some CE courses and you can always get good at your work. So it's not like you have to go to kind of university, only then you are going to be on top of the world. Like if anybody hears anything like that, it is not true. Okay. There are some, let's say when you're applying for a job, there could be some employers like who feel that, okay, I will take only people who go to school, right? And there could be some employers. I have personally spoken to some employers who actually think that people who go through the equivalency process are a lot more smarter. They are a lot more efficient. They are the ones who are really good. That's why they got through the Canadian exams. And the ones who went to school are like the dumb ones, right? Because they could not pass the exam. That's why they went to school. So that's also a thought that is kind of like, like lurking in the corner. So do not think that if you are going to if you don't get to go to school, you're doomed. No. Now, if you look at odds of getting into school and the odds of passing these exams, both are pretty low. It is a very competitive process. Absolutely, you can make it. No doubt about the fact that you can make it, but it's very, very competitive, right? It's not easy. So, I'm going to talk about percentage passes soon, but on an average, all these exams have like a pass rate of less than 50%. So, which means out of like 10 people, less than 4 people get through to the other side. So, if you're going to think logically, it means that the odds of an individual getting through either of these processes is very difficult. So basically, regardless of what your experience level is, we encourage you to try both options. Okay, there is no question of should I do this or should I do that. That doesn't exist, guys. I again repeat, do not sit and worry about should I do this, should I do that, should I do AFK, should I do ADAT. You got to do both. You simply got to do both because you don't know what you're going to get, right? You can't say, oh, I don't have any experience, so I'm not going to waste my time doing AFK. That's stupidity. What if you don't get accepted into any of the schools? What are you going to do, right? So you have to try both. There's no question about whether you're going to leave one or not do the other one. You basically doing both. Okay, that's why we have decided to integrate these courses together so that once you go through this course, you will be having the ability to take both routes. You can pick and choose what. Of course, we cannot point a gun at you and say write both the exams, but that's finally up to you. But we equip you to take both these exams. Okay, so I hope I've kind of made myself very, very clear about this. So if you kind of like look at this, it just tells you that this is like basically the pass fail process for 2021. I think those numbers are very different now. So AFK numbers look pretty bad there, as you can see here, 149, 324. But I wouldn't really worry about it because this keeps changing. So like on an average, like let's say about 4 out of 10 people pass the AFK. That's what happens. And ADAT is all about scores, and Dr. Sagar will be kind of talking to you about that. So 4 out of 10 is a pretty bad number, honestly. So you have to really work your ass off to pass these exams. What is like, this is a very relevant slide for students who wish to apply to universities, right? So if you carefully observe this, you see like Brazil 24, Nigeria 24, Egypt 39, Lebanon 22, Iran 113. Again, Pakistan 77, India 904. So that's a lot. Okay. So if sort of comparatively, a lot of students are coming from India to Canada, right? Simply because our medium of instruction is English, and we find it very, very comfortable to like to move to a country like this. So what happens is when it comes to universities, they want some diversity there. So they don't want everybody to come from one country. So if you are from India, so what's going to happen is your gateways will be a little more tighter. Like let's say there is a student from Nigeria who scored as much as you, or somewhat close to what you've done, and they've already taken 5 students from an Indian background. They will not hesitate to choose that other Nigerian, okay, ahead of you, right? So that's a little bit of an issue that you have to keep into basically take into consideration. So if you're from India, you have to really work hard to be ahead of other people. So this is unfortunately is a race. Okay. So we have numbers for like 2023 like results here. I mean, 2024 results are not out yet on like the website. So as you see here, 1,814 people took the exam, what 49% passed. Pretty encouraging, I'm going to say, not so bad, like a little less than 50%, as I kind of told you. And they've also given like I mean numbers for kind of like the first time test takers, whereas repeat test takers. So no matter what happens, like that number is like little under 50%. Like doesn't matter if you're taking for the first time or you're repeating this exam. Either way, it's like slightly less than 50% people pass the exam. Now, ACJ results have been really good last year. Now, it has not been that great this year. So when you look at the ACJ results for 2024, when it gets out in 2025, it's going to be a little different, but it looks pretty nice on that 81% pass, right? And if you see the ACS exam also, you see that, I mean, the 2023 results have been pretty good. Now, these things keep varying. Like, I want you guys to understand this. At this time, you're only worried about AFK, but still, right? So they have a certain number, like the NDEB, all the Canadian provincial authorities, like, I mean, the number of dentists who are retiring, I mean, the number of students who are coming out of school, they have data for all these things. So they will let only a certain number of students get through every step based on their requirement, right? So what's going to happen is that pass percentage is going to change. Now, for example, if there are a lot of people who have passed ACJ and there are a lot of people waiting to take this exam, the NDEC exam, they will cut short the pass percentage in the ACJ exam. If they don't have too many people writing ACJ, for example, they don't have too many students in this pool, they will increase the pass rate of the AFK exam. Okay, so at any given point in time, if you are on the top 50% or above, there is a good chance. Like looking at these numbers, I'm not coming up with any kind of magical number. So if you're in the top half of any segment of students, the odds of you passing these exams is very high, right? So it's not like you get a 75 to pass, you get certain number of questions to pass. It's not like that. It entirely depends on how other people have done the exam. So if you're, in case of everybody has done well, then you have to do really, really well to get ahead of them. It's all about getting ahead of people. It's not about getting certain number of questions right. So do not, I mean, misinterpret. Oh, if I get like, I'm taking 100 questions in the first exam, I'm taking 100 questions in the second exam. If I get about like 60, 70, 75, what is that magical number? If I get it, I'm going to pass. We don't know that. It entirely depends on how others have done. Now, for example, if the highest score in that exam is 50 out of 100, which is possible, somebody who's got 45 is still doing well, right? So, and in case of the highest score on an exam is like 95, then, you know, somebody who's even got like an 85 might be behind. I hope you understand what I'm trying to say. So people who write the AFK exam or ADAT exam or any of these exams, they write it and come out, they can never be sure what has happened in that exam. We have absolutely no clue because your score is a percentile, right? We don't exactly know, like where you stand, right? So that this is actually an issue. So only when you talk around, okay, you find out, okay, you people talk about how much they've scored. Over time, you might like realize, okay, you know what, my score is not bad as far as this time is concerned. So what is the message from this slide? Try to be on the top. The only way you can be on the top is to start working as early as possible. Okay, so similar numbers for clinical skills exam. As you see here, you have like 34% pass for this, which is pretty like typical. So as you see here, about like out of 10 people writing this exam, 7 people fail. And you have the situational judgment exam. You have like approximately 50% pass. And again, you have like repeat test takers and the, if you notice this, like clinical skills is a slightly better like result for like repeat test takers. That's because they've been practicing on those plastic teeth for longer, but the pass percentage is still hovering around that zone, right? So that's what I want you to take from all this. Okay, so it's important to love what you do. Okay, so it's a very, very important. No point in sitting and worrying, oh my God, I have to do all this. And don't get into that state. Okay, take one step at a time. Enjoy whatever you're going to do. I can guarantee you one thing. I'm just talking about our ADAT AFK course. When you start this course and when you finish this course, your knowledge in dentistry would have gone to the next level. I can literally promise you that. And I can tell you something. All our instructors are people who love what they do. They like dentistry. They like to practice dentistry. They like to teach dentistry. They enjoy what they do, and you will get that vibe, when you're attending these like lectures. Okay. Um, Now, I mean, talking about these lectures, so we have the lecture can be done in three formats. Like, number one, you can attend it in class. I mean, number two, you can attend it online. Number three, you're going to get recordings. So you have three ways to do it. So our personal advice to you is to come to the class. Like, I cannot insist on this more. If you live anywhere within 2 to 3 hours, like, it is totally worth attending the like lectures in class, because the kind of concentration that you're going to have when you're sitting in the class, the interaction that you're going to get with your peers discussing, all those things, I mean, it's going to be amazing. So it is really, really good. Now, having said that, I'm not saying doing the recordings or doing the online sessions is bad. It is also pretty good. But obviously, you don't need to be some Isaac Newton or even Steve Jobs to say that, hey, you're going to have a better experience like in the class, right? So of course you have to find a means of transport and kind of get to the class and go and in all that, but it's totally worth it. Like, we have noticed that students who come to the class, I'm not saying this to entice anybody. You can actually contact Mr. Naresh or Manni. They'll give you exact numbers. People who attend the classes have a significantly higher passing rate. That is only because of the level of engagement that they get in the class. So, like, I cannot insist enough on that. Consider coming to the class if you are able to, and please do it. Like, you are going to see the result. Okay, so the AFK is going to be our first step in the equivalency process, and it is the first step. It is the most important step, and this is the exam where you're going to be getting the building blocks, right? So if you look at these Lego sets, if you take these sort of building blocks, right, kids play with. So each block you take block by block and you attach them together, and then you make something out of it. So that's basically what AFK is all about. AFK is all about attending lectures subject by subject, which are going to be your blocks, and finally amalgamating everything into your knowledge, which has to be used when you're answering questions. So when you're answering an MCQ question, it won't be like it won't be like something which you can recollect an answer. It's not like that. A lot of these questions are, you have to use what you know and apply that knowledge from various aspects of dentistry, and then you attack the question. Okay, that's how it's going to happen. So the AFK knowledge is very important. And a lot of our students who take the ACJ exam, they take their situational judgment exams, they go for their school interviews, they say that they even after going to dental school, they are reading our notes. And I can have a lot of students come and testify here. They are going to come and say, even in their dentistry, even in their practice, they actually open up the course material that we give them to kind of refresh their knowledge. I can tell you hands down, the course material that they're going to receive from us is the best, like in the market, because we don't give you stories. Okay, Dr. James is going to be talking to you about this. We don't write stories in the handout. It is very concise and it is to the point, which means every word written there is important. You just have to focus on that. We don't beat around the bush. No beating around the bush. It's just go for a direct attack. Okay, so that's exactly what we do. And I'm going to let Dr. James talk about that further down. So the AFK test format involves, as you guys know, it involves 100 multiple choice questions, 2 hours each, and morning and afternoon of the same day. So, by the time you finish the exam, you could be pretty tired. Okay, that's for sure. And if you look at the AFK, again, the blueprint, it's, in my opinion, it is vague. Like, it's super vague. They've given you things like pharmacology, medical emergencies, medicine, including physiology, 24. Look at all this: orthodontics, pediatric, geriatric, 10, pedo, micro, 10. That, I'm sorry to use this kind of, it's just ridiculous, because this doesn't even matter. Like, this is like waste, because, like, if they are going to tell you something like, a 26-year-old patient with a history of diabetes mellitus, he has Crohn's disease, kind of reports to you with a lesion in the buccal mucosa, and he had a recent amalgam restoration placed, and that was tended to percussion. X-ray showed a periapical radiolucency, something like that. Like, imagine, like, if you just think about a question like this, what is it? Is it oral pathology? Is it medicine? Is it endo? What the hell is this, right? So they can literally play with the words. They can play with those, like, question constructions, and they can defend this vague blueprint that they have actually published, right? So our opinion for AFK is, you gotta go all in, right? You gotta, as I told you, like, remember it like a building block. Like, you have to get all the blocks in your head, and you have to use those blocks to construct answers. So this is absolute BS. ADAT, on the other hand, is a much more clearer exam. Like, it's pretty straightforward, right? So you have these basic sciences, which is otherwise called biomedical sciences, 80 questions. Like, Dr. Sagar will be talking to you more in detail about this. So you can see anatomy 20, you have biochemistry 20, you have you have micropath 20, you have dental anatomy and occlusion 20, right? So 80 questions, you got nothing to worry about. When you have questions on anatomy, you got questions on anatomy. That's it. Okay, they won't play with it. If it's going to be a question on micropath, it'll be a question on a micropath only. The only problem with ADAT is this basic science component involves painful memorization. Like, literally memorize pages after pages, all this Krebs cycle and this and that, and the names of the names of these microbes, the physiology, the enzymes, all those things have to be painfully memorized. But it is what it is, guys. It is what it is, right? So you have to memorize it. There's no other option, right? If you look at the other part of it, so this clinical sciences is pretty straightforward, in the sense it's more clinical, so you'll enjoy it. But here the questions are slightly different. You have some questions, and you have some case-based questions, etc. So it'll be more like, this is something you might enjoy, but it'll be difficult. Okay, so it's not going to be very easy, but at least you're doing some clinical dentistry, so it's not the end of the world. And this thing is alien to, let's say, everybody. So this is basically biostatistics. This is not science. This is biostatistics. This is mathematics. This is dry, and this has got a lot of numbers and problems, and different kinds of things like odds ratio and confidence intervals, and name it, you kind of got it, right? That's like 40 items. So that's a completely different animal, and it's very new to most of you. So you got to really pay attention to this, right? So ADAT, you got to do well in everything. A lot of people, they tend to do well in one and not do well in the other. But it is better that you have a uniform distribution. Like, if you're able to score well decently well in all components, it is better than doing exceedingly well in one component and totally messing up another one, right? So ADAT has its own, like, devil's buried inside. So you just have to be aware that these are two different exams, but the material to study has been put in together for you, right? So, and when we are doing these lectures, we will be talking about which is more AFK specific, which is more ADAT like specific, but the entire curriculum is together. So you got to study the whole course to take both these exams. So there are two types of questions you guys have to be kind of ready for. One is a logic-based questions, which is the most important thing. So, like, a logic-based question is when it comes to AFK exams, let me talk like specifically about AFK and then specifically about ADAT. So when it comes to logic-based questions, you will get these mainly like in your clinical aspect of these exams, and sometimes even in your biostatistics, where it's all about application. it's all about application, right? So the same, I don't want to sound like a broken record. So it's basically using your knowledge to answer a question. I mean, a theory-based question is fairly uncommon in your AFK exam. Basically, what's a theory-based question? They can ask you, which bacteria causes this, or what is the dose of this particular drug, or whatever, right? So these like questions are far and few in AFK. But if you look at the ADAT basic size component, you have a significant amount. Like, in fact, all the basic science questions are like this, right? You have to just remember and you answer. If you don't remember the answer, you're screwed. As simple as that. So that's a theory-based question. So for AFK or even like the clinical exams, these kind of theory questions are like more common, but I'm sorry, are uncommon. Whereas your logic-based questions are the ones which are more common. So so basically, there are, if you think, okay, how many questions should I literally like remember a number or a name and then answer the question? That will be more in your ADAT basic science. Okay, you will get some questions like that in AFK too, but majority of these kind of questions are going to be in ADAT basic science. The ADAT clinical science, the ADAT biostats, and the AFK in entirety is going to have questions where you apply. It's all about application. It's all about getting the concept in your head. You have to understand concepts. Okay, there's no use in like simply memorizing stuff, and that's something which you will realize once you attend a couple of lectures. Okay, so what else have we have to kind of talk about? Oh, of course, we have to talk about the scoring system. I mean, the scoring system, I don't want to confuse you too much. What I want you to know is, let's say you write your exam and then you get a score, right? Once you get your score, it is equated based on, I mean, the percentile is kind of calculated based on the highest score in that specific exam, okay? And then after that, it is rescaled according to the previous year's exam. Okay, I want to just clarify this to you. You write the ADAT or the AFK. Let's I mean, like in 2025. So if you write your AFK like in 2025, your scores are rescaled in such a way, that it is comparable to someone who took the exam 10 years ago. Okay, so I mean, somebody who took the exam in 2015, it's like you guys took the exam at the same time, if you can understand what I'm trying to say, right? So they take out each exam, they equate the score according to the scores of that specific exam, and after that they come up with a difficulty level for that exam. Okay, maybe I mean, your exam is going to be something very easy. Let's say a lot of people got like 80 on 100, right? Now, if you take an exam that was done 5 years ago, maybe in that exam, people only got 50 out of 100. I mean, like that was the average. So now how do we make these scores comparable? Like, how can you say, oh, are you going to say that you are better than all those guys who actually took the exam 5 years ago? No, you have to equate it. So that is called rescaling. So they rescale the score according to the difficulty level. So it's a very complicated number. Don't even try understanding this. All that I'm trying to tell you is, when you write this exam and come out, you have no goddamn clue as to how much you're going to get. You have no clue, because you don't know how difficult the exam was for other people. How have others performed in the exam, and what is going to be the raw score, what is going to be the mean score, what's going to be the highest score, and how does that compare with all the exams taken in the last, I don't know, zillion years, and what is going to be your score in the end? Believe me, even God doesn't know, right? It's ridiculous. So trying to figure this out is a waste of time. I'm just trying to tell you that it's not like some people say, sir, I did the exam so well, I thought I answered everything right, and I don't know what the hell happened. What happened is equation and rescaling, and you didn't stand up to other people. As simple as that. That's why you did not make it. So you cannot come out of an exam and say, oh, I think I did very well. And even the opposite happens sometimes. People think, oh, I'm gone, I'm screwed, I'm going to fail, right? And then they pass. I mean, like, they're like, I don't know what the hell happened, because again, the same thing, when they equated your score, when they rescaled your score, they ended up with a great score. As simple as that, right? So like, so don't worry about how much you're going to score. Focus on how to get better. That's it. Okay, so these kind of materials like dental decks and Mosby and First Aid and Kaplan, these are good for ADAT. They are not useful for AFK. Okay, mark it down. This is okay for ADAT, not good for AFK. Okay, so what you need is a different like type of strategy for, the US, and then you have like a completely different strategy for, Canada. Like what I'm trying to tell you is the information you're going to study is the same. You're going to be studying the same material. Now understand that, like studying something and applying it is a different story, right? So for instance, let me introduce the INDB exam to you. This is a 12-hour, 30-minute exam. There are 500 questions with breaks and a survey. So this is like everything put together kind of thing, right? So, but the good news about this exam is somebody who's prepared for AFK and ADAT, I can almost give you a pass rate is going to be over 80%, because among all the three exams that I kind of we have discussed about, this is the exam easier to pass. Okay, so you don't need to specifically study for this. Maybe you can get some, online, if you want to get some papers to solve or whatever. You have a lot of info available on, YouTube. So just to modify to see what exactly this exam is, if you're going to write this and go to the States. But otherwise, if you look at the study material, like what we are providing you is pretty much covering up everything. You got nothing to worry about. So, the strategy to take an exam to go to the States, or, for instance, the ADAT exam, um, you know, or the INDB exam, or any of those things, is slightly different from the AFK exam. Okay, so what we recommend here is you are basically going to study for these exams according to our format, which Dr. James is going to be talking to you about. But what I'm trying to say is, kind of attack the exams individually, because your mindset has to be different. Now, for example, if you're planning to take both the exams first, if you're like so you're going to finish off your AFK, so you're going to study everything. Of course, everything is going to be studied for both exams, no difference. And then you're going to take the AF. So until like, February first week, your mindset should be AFK. Okay, until the first week of February, your mindset should be AFK, right? Once that exam is over, immediately you will be switching over to ADAT mode, right? So that's how we have even formatted the course, and then your mock exams. So you will, once AFK is over, using the same knowledge, you're going to shift to ADAT gear, right? So that is what you're supposed to do. Don't try to simultaneously stay in both the exam modes at the same time. Don't think ADAT and AFK at the same time. Think of the material, think of the science, think of the knowledge, think of that when you're like studying. And once it comes to the mocks, when you're doing the AFK mocks, be in the AFK mode. Like the moment you come to the ADAT mocks, you move to the ADAT mode. Only then you can function properly and act properly. Because otherwise, both these exams are slightly different, as you see, not slightly, significantly different. So you have to keep your mindset, tuned to each exam. So you got to get familiar with the theory, and you got to construct the concepts based on what is taught in the Canadian faculties of dentistry. Now, this is a very important point, because you would have been taught something somewhere, a book would have told something, and none of that is there in the key, because this is Canada, right? So they have certain things, certain papers, certain articles, certain, like even like the dosage of ibuprofen, like for example, is like different in Canada when compared to the States. So you need to know those like specific information. So some book would have said something, but what is taught here could be slightly different. So you got to keep in touch with that. So that is why this course is important, because like we have all gone to dental school here, all the instructors, and we know what is taught here, what is the format, what they expect from you guys, and our handouts are tailor-made for these exams. So we know what to apply where, and then that's what we're going to be teaching you. And we keep in trends with the changing pattern. So that's very, very important, because like the way the exam is changing, if you look at an AFK question paper 10 years ago or 15 years ago to an AFK question paper now, they look like two different exams, because they are very different now. It's changed. And so have our mock exams. So if you look at our mock exam papers, which we did in 2015, so we are doing this course since 2015. Basically next year, August will mark our, completion of 10 years. So like when I look at, like the mocks that I prepared, 10 years ago to now, it is very different, very, very different, because like the entire question is different. The entire format has changed. Like the difficulty level, the type of concepts have all changed. That is very important. So if you need somebody who's keeping track of those changes, and they're kind of presenting those changes to you, so you are ahead of other students, which is what we do here. We make sure that our mock exams and our material is constantly updated, and this is very necessary for you, and this is a painstaking process, okay, which we are doing for you. You don't need to worry about that. Again, guys, don't be silly, like posting what we are teaching you online, like just taking those release questions and, kind of discussing it openly. Avoid all this stuff. Don't do anything silly. We just have to make sure that we like respect the copyrights of the NDEB. So don't go crazy about it. I mean, like selling the stuff that we give you, and things like that. We've always noticed that these like students actually don't get through the exams. They're just wasting that time doing this part-time business, and they don't really do what they've come to do here. Okay, so this is old news. We all know that. And I would like to end my presentation with this quote here. There are some people who live in a dream world. There are some who face reality, and then there are those who turn one into the other. So we want our clan of DSTC students like to be the ones who are like, they convert your dreams into kind of reality, okay? And all that you need to do is to simply follow our instructions blindly. Don't worry about it, okay? And we will be bringing students to the class who will be talking about their experiences. We will be bringing students who have passed the equivalency process, who started exactly, they were sitting in the same orientation a year or two ago. Now they have got through these exams. The same students who were there in this orientation 1 year, 2 years ago, they have got into dental school. We are going to be bringing you these people into the class so you can directly interact with them, okay? So we will give you first-hand experience to kind of and they're going to tell you all the pros and cons, how they studied, how they kind of made it. We are going to be talking to you about all that. And I want to tell you guys something. This entire thing is doable. This is not like the Olympics. You don't need to win a gold or a silver or a bronze. You just have to pass these exams. But one thing I want to tell you is it is very challenging, and don't take it lightly. And even if you say, hey, I'm going to be taking the exam only next year, August, so I should maybe start preparing from next year, January. No, that is the biggest mistake you're going to make. One thing you're going to realize, it only takes 2 weeks for you to realize that the material is exhaustive. A lot to remember, a lot to study, and a lot to revise, okay? So it is, the more time you have your hands on these things, the better you're going to be getting it. So better you're going to absorb them, right? So another thing I want you to be aware of, this is something I want you to do your own assessment, is how good a student were you back home when you were doing your BDS, because it plays a significant role when attending the classes. Because somebody who's been a good student, a very knowledgeable student, somebody who's like read from a quality textbooks, whose knowledge is already pretty good there, those students are going to absorb more from the classes than the ones who did not, okay? So, but you cannot change what happened 5-10 years ago. Like, even if you graduated 15 years ago, if you were a good student, it'll make a big difference. You'll be surprised. How long before you graduated doesn't matter, does not matter, okay? Because your brain has like stored information, and once you start I mean listening to these lectures, you will start understanding, remembering. Everything is going to come back to you. But the ones who have not studied from standard textbooks, who have barely managed to kind of pass their BDS and somehow reach Canada, you guys have to put in a little more effort. You guys have to spend a little more time, right? So which means you may have to do the course, you may have to attend these like lectures, you may have to re-listen to the recordings, you may have to spend some more time, like you may have to start preparing for next, 2025 August exam in this August. It might take a year. So what I'm saying is, do not think, "Oh, I'm going to take the exam only in August next year, I'm going to join the course only the following year." That's a very bad idea, because even if you're a good student, the sooner you have your hands on these handouts and you start preparing, you're going to get better than others. And as you see, all these exams are highly competitive exams, and the sooner you start preparing, the better it is. Okay. So the course details, Dr. James is going to be talking to you about this. So I'm just going to slip through this, and we are here to offer you help, support, advice, guidance, and assistance. With this, I sign off, guys. I'm Dr. Vinod, and I'll be teaching your first lecture in pharmacology, and you should be getting the schedule in hand. And I am passing if you have any significant questions for me, I'm going to say hold on to these questions, because Dr. James is going to be talking to you about certain topics. Dr. Sagar is going to be talking to you about certain topics. So just make sure you hear everybody out. Maybe your questions are going to be automatically answered. And after that, if you have any questions, we will be happy to answer your questions. Dr. James, do you wanna, I'm just going to stop sharing my screen, James.
Yeah, perfect.
And you can, I'm just going to, I'm just going to, or you can just take over the thing, right? You can, or I will just get out then, and then you can come and, what do you say? That makes sense?
Which is what I did right now, so
yeah. Okay. So I'm just going to leave the meeting. I'm leaving.
No, you don't have to leave, So I'm the host now, so you can stay as a participant. I think he left. All right, guys. So people online, are you guys able to hear me?
Loud and clear.
Perfect. Okay, guys. Okay, so from where Vinod left off, so Dr. Vinod gave you a brief idea of what this exam is, how you acquaint yourself to getting into the process of the exam, and an overview of these different exams. So my role here is to just tell you how this course is going to be delivered to you. Okay, so welcome back to school would be the right words to use. So the next 6 months would be rigorous. So it'll be like a drilling session. It's going to be 3 times a week, 3 days a week would be how we'll be delivering these courses to you. And this is actually true. So welcome back to 2nd grade, because some of these exams are trying to equate you to a second year of dentistry here in Canada. So you don't have to be a specialist back home, so on and so forth. So you don't bring anything extra if you're a specialist. All these exams is trying to equate to you to a 2nd year graduate here in a dental school. Okay. So it's ironically true, so but unfortunately true as well. So it's that's how you're going to start for these exams here. Okay. Now there would be comprehensive in-class lectures and discussions that would happen. So how many lectures of contact between the instructors and you guys would be around 50 sessions. So 50 sessions of didactic interaction. So meaning a lecture is not like a one-way delivery. So I'm not going to stand here and deliver the lecture constantly. So it'll be I'm not sure how to put it in. So if you come sit in a lecture, so it'll always be a discussion back and forth. We explain something, so there would be doubts, so we would be interacting constantly back and forth. These lectures would be given to you as referenced handout printed to you guys. So a referenced handout, okay, so would be each subject would be a bulk of material that comes to you beforehand, so you can review these subjects and then get back to us during the class. We'll also be giving you recommended textbooks for personal reading. So some of us would be really good in certain subjects. Some of us would have gray areas in dentistry. So for example, orthodontics for me, so I would want to refresh myself with a few other extra reading. So we would tell you which book to read, and we'll give you those recommended reading textbooks as well. Okay, so it doesn't mean that you have to read all these textbooks. The handouts are extracts from these recommended textbooks. But if you need extra reading, so we always give you these books for you to read. Okay. Every class would follow a question discussion, so there is released questions which would be discussed. Okay, so these would not be the same exact questions, so but paraphrased, rephrased, something that's similar to the questions that's released, so but it will give you an idea of what the question is and how do you arrive at an answer. So we also have ways of testing you guys, so and keeping you guys on the go, so meaning in case of we don't want anybody to fall back, relax, so on and so forth, so there would be progressive tests every 2 weeks, and the final exams would happen at the very end of the course, so just hold on 1 second. Yeah. Okay. Well, guys, okay, so sorry about that, so but anyways, so let's continue. We were right here. And are you guys able to see the same screen as us right now?
Dr. James, we don't see your, we can see the presentation, but we don't see it in the presentation mode. That's it.
Yeah. Okay. So I'm getting back to where it was right now. Okay, so sorry about that, guys. So let's get back to where we were. Okay, so I was talking about this year. Okay, so the two ways to test you guys would be every 2 weeks we would have progressive tests going on, so, and we would also have the final exams, which would be 8 full exams that you would get, and followed by a discussion with you guys. Handouts. Okay, so a typical handout would look like that, so it would be evenly spaced out. Okay, so its font size are ideal to read. Some complaints in the past where, so the legend under the pictures, so some of these pictures would come with text under it. Those were a little not readable and stuff, so but we have ways to get around it, so you would definitely get these textbooks. We'll tell you where to find these texts if you have to read them, so most of the times, so it's not necessary for you to read the legend under the picture. If it was important, it's part of your handout text for you to read. But if some of you guys are really wanting to read that, so then we'll tell you where to find that from. Okay, so a typical handout, okay, so would be this. Okay, so for example, so I've taken out page number 1, page 10, page 69, so on and so forth. So some of the handouts are really bulky. Some of these handouts are really easy. So depending upon the weightage of the subject, so if the subject is really important, you would get a bigger handout. But if it's not, so you would get a thinner, simpler handout for you to manage. End of the day, okay, so the printed material that you would get, okay, so would come to you on a folder, okay, so and the folder is as fat as this in this picture that you see. It would be colored, indexed, so on and so forth, so it's easy for you to organize, okay, so and acquaint yourself with each of these subjects. Okay. The released questions, again, they are copyrighted by NDEB, as Dr. Vinod said, so try not to share this and stuff, so, but we would give you questions which are very similar but paraphrased, so which will sort of answer all your questions that you would get in your NDEB exams. At the end of the day, okay, so reading, okay, so would help, so but just reading, okay, so would be barely enough, so you'll have to ask yourself a lot of questions, relate information that you already know to what you gain from us, draw information as it's more visual, so drawing is much more beneficial, I would say, so especially anatomy, so if you draw it, you know it, that's the word. Okay, so for example, nerves and stuff, so nerves, muscles, orientation, course of nerves and all this. Okay, so if you draw it, okay, so you sort of know it better than just looking at pictures and reading from it. Flashcards are always encouraged, so some people who walk around with flashcards are definitely more information gathering people than some people who just read the handout. Okay. So a new handout would look like that, so a brand new handout would look like that. At the end of the course, I would want all of your handouts to look like something like this, so it should be scribbled on, so if you bring a handout to me at the end of the fag end of the course and show me a brand new handout, it sort of tells me how you've used the handout effectively. Okay, so the more you relate information right on your handout, okay, so understand things better, so the more easier it's for you to get used to these courses. Okay, so now that being said, so we'll keep this as a brief introduction, so and I'll also add a few more things before I pass on to Dr. Sagar. Revision checklists for each subjects is something that I encourage you guys to do, so for each subjects, there are a certain revision topics that's very important, so now how many times should I read the handout will always be a question, so each subject will come with a handout, and how many times should I read the handout for me to understand the handout better will always be a question that everybody is going to ask, so the magic number is 3, so at least 3 times reading of each handout is a must before you go to your exams, so if you read the handout once and tell me you've read that subject and you're going for these exams, so it may not work for you guys, so now when you read it thrice, you have to make a checklist for yourself for you to understand, so what's important, what's not important in each of these subjects, so at the end of the course, each of you should have a checklist for you to quickly revise each subjects and go from there. The books or the recommended books for reading, so not reading, so for referencing or skimming certain topics that's important for you guys will come through a Google Drive folder. The folder would typically look like that. Each of these subjects are labeled, so and if you, for example, if you open up oral pathology text, the folder, you'd have 2 books here. Okay, so one is Neville, obviously, which is the most important one. And when you open that, so there are some texts which are very important, which are marked there for you. Okay. So for me to give this to you guys, I would need a Gmail ID, so without a Gmail ID, you cannot get a Google Drive folder. Okay. So now there are some people who are very prompt in giving a Gmail ID. Okay. So there are some people who would give it to me at the end of the course, so without a Gmail ID, so I cannot give this folder to you guys, so the sooner you give it to Manmeet, so he is the manager. Okay, so he organizes things, so if you, the sooner you give it to him, so the easier it is for us to transfer the drive to you guys. Okay, so and tests, progressive tests or bi-weekly test is what we call. Okay, so it comes through an online portal. Okay, so it will be categorized, so the test is delivered at a certain time, probably on a Sunday evening, so there's a time that we normally ask the class, which is common to everybody, so and then we open up these tests for that period, that window of time, so and you open up these tests, answer these questions, and you get a score, and we discuss these questions with you guys. At the end of the day, these tests are not reflective of your scores in your final exams. Okay, so why do we have these tests? It is just to make sure that you read the subject at the end of the day. So for example, if I'm going to finish anesthesia, okay, so you would get a progressive test, which is to make sure that you read my handout at the end of the day. Okay, right? Okay, so no way it is going to reflect your AFK scores. It is only to monitor and tell you guys, so, okay, you've done well, so in so many subjects, so you should have a good final mock exam and stuff, okay? Some people who fail these tests are very, very disappointed, so they would come back and tell me, so I failed these tests, I'm not ready for AFK, which is not the case, so these are just for you to be with us as the course gets more difficult as it goes. Okay, so that's a picture of a typical question, so you click on an answer, okay, so it tells you if it's right or wrong, and then we go from there. Okay, so a basic summary of everything that I told you is right here in this one slide. Okay, so just be awake for this one here. Reading can either be your guided, targeted reading or your unguided, your self-directed reading. Okay, so your guided, targeted reading would be your handouts and the important articles that we give you. The unguided reading would be the textbooks, which would come from a Google Drive folder, so which is up to you guys, so you're weak in certain subjects, so you can open up that subject and read. Okay, so that's totally going to be unguided, but the guided, targeted readings should be your handouts and the articles that we give you. Assessment, okay, so it's also done in two ways, so the two ways of we testing you guys if you are ready or not ready would be the bi-weekly test, and the most important means of we telling you guys, so if you're up there, so if you're okay for your exams to be taken would be the final exams at the end of the course, so we would always have a slab, people who go above the slab, so we would say confidently, so you can go ahead and get the exams done. But if you're below the slabs, so all that it means is you need more preparation, okay, so, and then go to your exams. And some questions which always comes to me would be, can I work and study at the same time? If you can manage time, okay, so you can do it. So to do justice to the exam and also make some money, okay, so you would have to make sure that you give it at least 30 hours a week of studying, so 30 hours a week of good concentrated studying, okay. What should my study pattern be like? Okay, so you should read your handouts, solve your questions, and also take your progressive tests in time, so I had so many people who would come here, so they would sit in the lecture and not take a progressive test, so for what reason we don't know, so they would which will I can log online and tell, so who took the test and who's not taken the test and stuff, so some people never take the test, which means that, so they're not ready for the exams and stuff. Per day, so 5 to 8 hours of active studying, so should be good enough at this time, so this is a competitive exam. If you can put in at least 5 hours of studying a day, so at this time, okay, so we should be okay. At the fag end of the course, so you should be putting in more hours of studying, okay, so but as of now, so if you can put in 5 hours of day, okay, so which is good enough for you to be in the class, so actively listening, reading, understanding, so on and so forth. All right, guys. Okay, so I think that's pretty much what I had to add here. Okay, so now I'll pass the buck to Dr. Sagar. Okay, so he'll take up from here. Dr. Sagar, are you here?
Yep, I'm here. Guys, I just wanted to ask here, do you all need a break, a quick 5-minute break before we go ahead? I know a lot of information has been thrown at you. So what do you think? Are you guys good to go ahead, or do you want a quick 5-minute break? You can unmute yourself and let me know.
Good to go, sir.
Okay,
Yeah,
good to
sir.
go.
Good to go,
Perfect.
sir.
Perfect. I can see quite a few familiar names here. So welcome to the class today. I'm Dr. Sagar. I'm going to talk about ADAT. Okay. So usually we have another instructor, Dr. Abhishek, but he is out of the country, so I'm going to handle his bit as well. So what I'm going to speak about today is the ADAT exams. Now, I usually like my class to be very interactive. Okay, I encourage people to ask questions when there is time for questions, but if you keep unmuting and asking questions in the middle, it kind of gets it interrupts the flow of the class. So I would encourage you all to open up your mics and ask questions at the end of this session. If you have any burning questions, please do put that in the chat. But if there are any questions that you'd like to ask specifically, if you could just ask it in person at the end of the session, that would be amazing. Okay. Now, is everyone familiar with Zoom? Has everyone used Zoom? I know this is a kind of a stupid question, but I'm pretty sure everyone has used Zoom. Can everyone just use one of those emoji icons at the bottom and just give me a thumbs up if you can hear me properly, if you can see my screen? Can you use one of those? Oh, perfect. I have a couple of hands up already. Excellent, excellent. So yeah, so this is generally how I communicate with students in the class through emojis. Yeah, I usually teach online. I'm based out of Ottawa and I teach online. So I prefer this class being interactive, but with less interruptions. So let's begin here. Okay, before we go ahead into the meat of this, I just have to put this slide out here, just a disclaimer that I don't have an inside line into ADAT, AFK, or any school applications. So I am a tutor. Dr. James, Dr. Vinod, Dr. Abhishek, and we teach. Our goal is to get you the best information there to make you ready for these exams. We have no insider information of how these exams go. We are not licensed by the NTEB or NBDE or the ADAT or any of these schools. We are not their interpreters. So when we give you any guidance, it is our opinion, it is our best knowledge at what should be done, what are the best practices. It is not a guidance from one of these institutions. So please keep that in mind. So a little bit about me. I am an internationally trained dentist like everyone here. Now, I do not like the term foreign trained dentists. We are not foreign. We are internationally trained dentists. We just need to requalify out here. So I am an internationally trained dentist. I graduated from grad school in 2014. I worked for a few years as an endodontist in Bangalore. I worked with a couple of companies, one of them being Ivoclar Vivadent. And we decided, my wife and I decided to make the move to Canada. So we moved in 2016, late 2016, and my wife and I were accepted into the dental school, one of the premier dental schools in the country, the University of Toronto. And I really enjoyed my tenure there. So I did quite a few things. I was a student ambassador. I was a research assistant. I really enjoyed working in some research projects involving biomaterial sciences, which is my forte. I was also the IDAP representative, and I was also a student ambassador there. So as of now, I work as an associate dentist, slightly out of the beaten path. I did not want to stay in the GTA. I did not want to stay in Toronto. I decided to move out right after dental school. So my wife and I, we moved to Ottawa. We bought a place, right after dental school. We moved right here, and I work at a small rural practice. I shouldn't say small. We have about 9,500 patients. We are a rural practice based out of Smiths Falls in Ottawa. It is actually south of Ottawa, about 65 kilometers south of Ottawa. And I absolutely love it there. The exposure that this has given me is just beyond what a school program could give. So today I'm going to talk a little bit about ADAT and school applications. So again, I'm going to ask a show of hands. Out of the people that are here, how many people have their sole focus as going to school? I just want to go to school. I am not interested in doing the direct licensing at all. So I have a few hands up here. Okay. Now, how many people have, a bit of flexibility? They don't mind going to school or doing the direct licensing. They want to, expand their chances, to increase the chances of getting in, how many people would not mind doing both, either going to school or direct licensing? Okay, perfect. Like, excellent. It's still going up. I can see a lot more hands here. Excellent. This is the point that I wanted to bring up. So when I went to, I went through this process. I went through my recertification process many moons ago. There was this option, a little bit of flexibility. You could say I did not want to go to school, or I wanted only to go to school. I don't want to do direct licensing, and it would still be okay. Back then, in 2017, 2018, there was a little bit of flexibility available. I'm not saying things were easy. I'm saying things were easier compared to what is today. Right now, we don't have that luxury of choice. You want to make sure you get into the market ASAP, because every year that you delay getting into the market, I'm sure you saw some statistics in the first part of the class. Every year, a dentist makes, even a fresher makes about 125,000 to 150,000. So every year that you delay getting into the market is every year that you lose 125 to 150,000. So my advice, my sincere advice to anyone who wants to recertify, whichever route gets you being a dentist in Canada quicker is the one that we choose. And to maximize your chances, you have to take up both the AFK and the ADAT exam. Now, having said that, I'm going to focus a little more on the ADAT exam. So what is the ADAT? So starting 2019, there was a bit of a splinter cell within the Joint Committee of National Accreditation. So they split from the NBD to INBD, and now they added another exam in called the ADAT. So the ADAT is basically governed by the American Dental Association's Council on Dental Education, and it is associated with the Joint Committee of National Accreditation. So all of these big acronyms and words, these are the premier dental education gatekeepers in the US. So the ADAT exams came forth typically initially as a exam for advanced dental training. So this wasn't the exam for college students to get into dental school. This was the exam for dental students to get accepted at universities for advanced training, like for PhD, endodontics, for oral maxillofacial surgeries, for GPRs. But then some schools, especially the schools in Canada, started using this exam as a benchmark for admission for internationally trained candidates into DDS. So here we are, now that most of the universities, other than two, are taking up the ADAT exams as an entry exam for internationally trained candidates. This exam has become more and more important. Now, this exam is usually computer-based. Pearson VUE is the deliverer of these computer-based tests. What happens in this is you will have the duration of test being 4 hours, 30 minutes. There are 3 parts. I'm going to discuss that. Generally, if you look at the exam, this exam can be taken in 1 day, and it is taken in 1 day in that one entire session. The administration session, time, it actually starts from March. So the cycle starts from March all the way to August of each year, meaning from September to March, there are no ADAT exams. There are no ADAT exams or slots from September to March. From March to August of every year, you'll be able to take up these exams. Okay, so from September to March, your job is to actually prep for these exams and also make sure your registration process is done. Okay, so this right now, you guys are perfectly timed to take up the exams starting next March 2025. Okay, so our course is designed to help you with that. So how do we apply for the ADAT exam? So firstly, you have to create a profile, just like the NDEB profile. You have to create a profile. So what you have to do first is you have to go on to this website and create what's called a dent pin. A dent pin is essentially your identifier. It is a profile that you have linked to your name. So once you have that dent pin, okay, you have to create what is called an ECE profile for ECE verification. Now, show of hands, has everyone heard of WES and ECE? WES and ECE, has everyone heard of it? If you have heard of it, put your hands up. Perfect. So if you've gone through the application process for a PR or even for a visa, student visa, WES or ECE means to basically evaluate what your standing is, what your education is, to bring it to the same level as a US school, so that they have an idea what is the equivalency there. So that's what your educational credential assessment does. Now, the thing is, if you get an ECE report, and if you don't have a dent pin, what happens is the ADA cannot link the two together. So you have to do these steps sequentially. First step, make a dent pin or apply for a dent pin. You have to pay some fees there and apply for a dent pin. Then second, submit your documents for an ECE verification. And then finally, once the verification is done, send the ECE report to your ADAT profile. Okay, and this is actually on the ECE website, how to create a ECE report. So there are questions every time on which report should I create, which is why I put this up. So if you're applying for the exam, only the ECE report that you have to create is a US general report. So again, if you are applying to a US educational institution, as in you're applying to some US schools, you have to create a course by course report. If you're applying to a Canadian institution, so this is a secondary thing. I want you to keep in mind, for the ADAT exams, you don't have to do this, but some schools ask for an ECE report, right? So when you're applying for that, this has to be done. You have to have a Canadian assessment report and basically you have to make sure that you can have more than one reports, because if you're applying to more than one schools, you need to have second or third report. So essentially, all you have to do first is get a US general report. This is what you need for the exam, and this can be done in the future, okay, for application to various schools. But again, there also they say you must have a dent pin. So without a dent pin, don't do this process. So the first step, create a dent pin and then move on to here. Now, these are the examination fees. And by the way, all of the information that you're seeing here is not something that I've magically created. This is not my doing. This is available on the ADA's website. This is available on the ADAT website. This is available on the ECE website. None of this is mine. This is not my copyright at all. So everything is from the current ECE and the ADAT cycle. So these are the examinations fees. So for us, as internationally trained dentists, this is our fee. And then we have to add another, cherry on top, because, well, why not? Right? This is a fee for non-accredited dental schools, which almost all of us are from. Now, this is the ADAT format of the exam. So this is current as of today. So this is from March 1st to August 31st, 2024. So the ADAT administration schedule is as follows. So when you take up an exam, right, any point of time here between in this cycle, in this administration window, on the day of the exam, you have a 4-hour 30-minute exam, which basically contains the first paper, which is biomedical sciences of 80 items, the second paper of clinical sciences, which is 80 items, the third paper of data research interpretation of 40 items. So if you add these together, you get 200 questions, okay? 200 items or 200 questions. Out of the 200, a bulk comes from basic sciences and clinical sciences. You can actually see 80-80 comes from basic and clinical sciences. a small part, or 40, comes from data research interpretation. People always, worry a lot about biostatistics. Biostatistics is something that you've never heard of. Biostatistics is something that, scares the living, Jesus out of you. But at the end of the day, biostatistics is a smaller part in the grand scheme of things. Okay, so basic sciences and biomedical sciences and clinical sciences actually form a whole part, a big part of it. Okay, so there were also some questions on how many times I can take up ADAT. The answer is 2 times in a cycle. So say I have decided to take up the ADAT in the cycle from March 1st to August 31st, 2024. So if I take up my first exam, say on March the 1st, I go and take up the exam. I wasn't prepared. I just gave the exam for the heck of it. I got a score. I didn't like my score. I can reattempt again within this cycle. So what usually happens is you have to wait for a average of 45 days after getting your result or after your attempt, and then you go ahead and reapply. So you can take up the exam twice every year. Okay, and this is there is a limit to it. There are, I think, 3 cycles as such, but you can take up the exam twice in each cycle. This is the course syllabus that you have. And again, I wanted to point out, biomedical sciences, this is something that requires a lot of memorization, because this is something that we would have forgotten after our second year of dental school. This is the first and second year of dental school. You can see anatomy, physiology, microbiology, pathology, dental anatomy, and occlusion. Basically, the dental subjects and the medical subjects of the first and second year of dental school is what this biomedical sciences paper is. Now, the second paper, it might seem very innocuous, right? Clinical sciences, 80 questions. Okay, I know this. This is the entirety of your AFK syllabus. Whatever you've studied in AFK is clinical sciences. So all of these questions, when you study for the AFK exam, right? This is what you are studying for. You are studying for this, the clinical sciences part of the ADAT. Meaning, when you study for AFK, you are good. But taking the same preparation and taking up the ADAT exam, you have missed out on part 1 and then part 3, right? You have only studied for part 2. This is why our course is designed in such a way that we teach you AFK and ADAT. So for the people who are taking up AFK exam, their tutorials, their training is done, and they get a little more knowledge about the ADAT exam. For the people who are taking up the ADAT exam, right? The clinical sciences is done as part of the AFK tutorial, and along with that, they have extra classes for ADAT specifically, which is biomedical sciences and data research and interpretation. So we are kind of giving you a holistic approach at getting certified. There's no longer, I'll take up only AFK or only ADAT. It's not possible. You have to have you have to basically cast your net wider, because you don't know where you will get in. And honestly, which is better, direct licensing or school? My answer is simple. Look at the finances. Whichever gets you practicing as a dentist sooner is what you pick. Doesn't matter whether it's direct licensing or ADAT or direct licensing or school, because at the end of the day, none of it will get you ready for practice. You learn more about practice in the first 3 months of practice than your dental school, your grad school, your GPR can teach you. That's the truth. So that's why get into practice sooner, and whichever route gets you faster is what you choose. AFK, ADAT, both should be taken. This is my honest opinion. Take it as it is. So what are the scores? How do you get a score? How do you know how well you've done in ADAT? So ADAT actually uses what's called a scale system of scoring. So they do a lot of statistical manipulation. They check and see if your your exam questions are at par with anyone who's taken up the ADAT before. So from 2019 all the way to now, if everyone has taken up the ADAT, your scores are held at par with them. So if you scored a 550 in 2019 and you scored a 550 in 2022, it is equivalent. That's what they mean to say. Okay, just like the AFK exams, they do a lot of statistical manipulation there. So they use something called a system response theory and a 3-scale theory to make sure the questions are of equal weightage. Their questions are of equal difficulty, and also, just for the fun of it, they make sure they take into account guessing game, because at the end of the day, you have one question, you have 4 options, so you have a 1 in 4 chance of getting the right answer. Even if you guess, even if I don't know what it is and I guess, there's a 1 in 4 chance of getting it right? That guess, they take that into account as well. So that is how comprehensive these exams are. These exams are not, I know many of you all are specialists, so you would have taken up exams like the AIPG, AIMS exam, the NEET exam, or the COMED-K, KCET exams. Believe me, I used to teach a course for that. I've been teaching online since 2011. I've been teaching courses for many entrance exams in India, and I've been teaching here since 2018. It is a lot different from what you've expected. AFK and ADAT exams are a different beast altogether. So the scale scores, again, if you take up a question, a paper of 200 items, and if you scored, say, 150 out of 200, your score is not 150. They take this score, a raw score, okay, and they stack it against anyone who's taken that score. Again, these scores are not percentile. These are not percentile scores. These are scaled scores. Okay, that's what they call it. It's called a scaled score. And then you'll get a score of anywhere from 200 to 800. Okay, these scaled scores are from 200 to 800, and their target mean is 500. So I teach data research and interpretation, right? So want to ask you guys a question. What do you mean by a mean? When I have a data set, what is a mean? What does that mean to you? Anyone? Would anyone like to open up their mics and answer? What does a mean?
Average.
Average.
of
Beautiful.
numbers.
Excellent. Average. Mean is an average. Beautiful. So a mean score, according to them, an average score of a participant is 500. So your goal is not the average. If you've scored 500, it doesn't mean you have a great score. It means you have an average score. So then which score is a good score, right? I'm going to explain that. I'm going to explain that in just a bit. And again, there is no passing or failing. So you can score a 200, you can score a 800. Doesn't mean you've passed at 800 or passed beyond 500. Doesn't mean you've failed if you're below 500. So there's no passing or failing. They just give you a score. And what they also do is give the universities a way to interpret their score. So after everyone takes up the exams in one cycle, say I take up the exam in the cycle of 2024, your ADAT takes up all of those scores, they combine it, they evaluate it, they stack it up against previous exams, and then they say, according to our standards, such and such scores equates with such and such percentile. And this is what universities use to actually evaluate how good a candidate is. So again, no pass and fail. Okay. And again, there are some questions which are experimental, which means out of the 200 questions, maybe 180, maybe 190, maybe 150 questions are actually questions that are relevant for your score. The rest of the questions, 50 questions, 30 questions, 10 questions, they are just experimental, meaning even if you've gotten them right, it might not add up to your final score. But if you get them wrong, it might be negatively marked. I'm not saying negative marking there. I'm just saying it might bring your score down. Okay. There's a waiting period of 4 days and a limit of 2 attempts per calendar cycle if a candidate decides to retake a test. Meaning, if I take a test on March 1st, I have to wait for a month and a half before taking up the exam again in this calendar year. And I can take it 2 times. And say the first time I take a exam, I get a score of 500. Second time I take the exam, I get a score of 650. All right. I can choose to send a score of 650 to the universities. I don't have to send a score of 500. And at the same time, universities won't penalize you for having a low score in the first attempt. So this is advantageous. Um, it's to err is human, right? If you make a mistake, you're human. So it doesn't mean that you've done something wrong. You have to learn from it, and that is what they expect you to do. Take an exam. If you made a mistake, learn from it and reattempt it to make sure you get a better score. That is the idea of having 2 attempts in the cycle. And it doesn't hurt that they get money every time you take an attempt. Okay. Now, I wanted to share some statistics between of the ADAT exams in 2023. Okay, so I told you, once you take up an exam in a cycle, they will collate all the scores. They will see how these scores stack up in relation to anyone who's taken it up from 2019 to now. So after the end of each cycle, they do that. So they weren't able to do it for 2024 because the deadline period is still August 31st, which means there are students who are taking up the exam maybe tomorrow, maybe in the next week until August 31st. So after that, they'll give you scores for 2024. But as of now, based on what we've seen for 2023, these are the statistics. So I told you, once you take up an exam, you get a score from anywhere between 200 to 800, right? So what they also do with their release is they tell you how these scores stack up in percentiles. So they will break it down into percentiles there. And I want you to take a look at the percentile, which is median. So this is the score of 2023. So what was their average number that they wanted? They wanted an average number of about 500, right? In and around 500 with a standard deviation of about 10. That's what they mean. So it could be 510 or 490. That is what they consider average. And I want you to look at the average score. So what percentile am I looking at? About 50th percentile. So the average score is between 480 to 490. So I would hazard a guess this is 486. This is the average score that people have scored in 2023. So this is based on 715 people taking up this exam in 2023. Now, I want you to keep in mind that just because you get a score doesn't mean you get accepted into the university. People often ask, what scores get you into the university? There's a lot of things that come into account before you can get into a university. But just to get your foot through the door, just to get a call into the interview or for the bench test, what scores are good? Honest answer is the better the score, higher the score, the better the chances. So I always tell students that don't look at what is the minimum score to get into university, because if you aim for a minimum score, you're going to fall below the score. So I want you to aim for a high score and try to attempt to get that. Now, if you get a little less than that, you still will be above the minimum score. This is my philosophy. Aim high so that when you get a score that is acceptable. If you aim for an acceptable score, you will get something that is below acceptable. That's the rule. Now, having said that, I want to extrapolate, how this can be. Again, this is my germane guess. This is not, I don't know who is at the university who is making those decisions. Well, I do know who they are, but I don't know what's in their mind. And I don't, I'm not claiming to have any knowledge of being able to influence this. I'm telling you, honest to God, I am just giving you my idea. So when we used to do this with AFK, people used to ask, what was a good score to get into university? Well, I could say what is a good score to get a call from university is anything above 90, right? The stronger the competition, it's better if you score above 90. Okay, so I want you to look at the 90th percentile here. What is the 90th percentile? What score is the 90th percentile? Anyone? Can you all read this? Can you all see what score is the 90th percentile? Would anyone want to say what score that is?
580.
Beautiful. A 580 score is a 90th percentile. So my honest educated guess is, if you want to be comfortably sure that you will get a call based on your ADAT score, there are other things that you need to get a call, and I'll talk about that at the end of today's presentation. But based on your ADAT score, what score should I get so as to, quote unquote, okay, please pardon my French, not fuck up my chances of going into dental school? What ADAT score should I get for that? The answer is 580. That is the bare minimum score. So should you be attempting for a score of 580? No. You should be attempting for a score of 600 plus, because that way you would be comfortably sure of making sure that the ADAT is not the reason why you didn't get a call. There are other reasons why that can happen, but to make sure why you didn't get a call, it's not ADAT, you have to make sure your score is above 600. That is my advice to students who score or try to aim for a score of 600. They get about 580, 590. People who aim for 580, they get 550. I've seen that consistently happening. Again, this is again not hard and solid fact. This is what's called anecdotal evidence. There are different kinds of evidence. One is peer-reviewed evidence, and the second is anecdotal. Anecdotal is, I've seen things happen. This is what happens in my experience, and that is what I'm telling you. Anecdotal evidence suggests if you score or aim for a minimum score, you get below the minimum. Now, I also want you to take a look at the other subjects. So this is biomedical sciences, this is clinical sciences, and data research and interpretation. So based on what your actual score is in each one of these, your say if you score 600 in clinical sciences, you might be in the 95th percentile, but the same 600 score will be 89th percentile in biomedical sciences, and it could be 92nd percentile in data research and interpretation. So typically what you get is 4 scores. You get 1 score for DRI, you get 1 score for clinical sciences, 1 score for biostats, and then 1 overall ADAT score. And people ask me this again, which is the more important score? Which score will be better? The answer is the ADAT score. Now, why? Because ADAT themselves tell you what is their score reliability. So this on their website, it shows you, this is not for you, by the way. Even though they have it on the website for everyone, this is actually aimed at dental schools. This tells the dental schools how to interpret ADAT score. If a candidate comes to them with an ADAT score of about 700, how to interpret that in simple terms. So what they say is the reliability coefficient for the ADAT scores is 92% or 0.92 for a overall ADAT, whereas it is 82, 73, and 75% for the subject wise. So as such, what they tell, it is clear. Department of Testing recommends that candidates and programs focus their attention on ADAT overall scale. So again, when someone asks, which score is important? Is it biomedical sciences? Is it clinical sciences or data research and interpretation? The answer is none of that. What is the most important score is the overall score that you've gotten. So say for anyone who scored an overall score of 620 in the 2023 ADAT exams, they have an overall percentile of 98. This is equivalent to getting 98 in AFK. That's what I want to tell you. So if you want to think back, someone with an ADAT score or AFK score of 98 is sure shot going to get a call into the university. It's not that they'll get into the university themselves, they'll get a call to the university, right? So always aim for a score above 600. So 600 itself is the 95th percentile, 580 is the 90th percentile. So anything above 580 and you are in the clear. This is what I tell my students. If you are below 580, it doesn't mean that you won't get a call. It's just that the competition there is much, much tougher, because closer you get to the average, more number of scores are clustered there. So once again, going back to the bell curve, where are the greatest number of scores clustered? The greatest number of scores are clustered right where the mean, median, and mode or the average combined there. So these exams, they usually follow a bell curve pattern. And if you look through any of their literature, they actually show you the raw scores in a bell curve format, and it'll show you the maximum number of scores. They fall around this 500, 400 mark. So the closer you are, more number of people have the same score. So the chances of you getting a call becomes slimmer and slimmer. It's not zero, it is less. So this is, again, this is the score that I was, the bell curve that I was telling you about. So if you actually look here, this is the bell curve, and this is the negative tail, this is the positive tail here. And if you look and see where are the greatest scores clustered, the greatest scores are clustered here. So anyone above 580 is safe. If you look at the number of people who are scoring more than 580, very less. So you are basically the elite, the creme de la creme. Okay. So again, this is a frequency distribution for 2019 to 2023. So this was only 2023. This is 2019 to 2023, which shows you again the, percentile of people who are, 580 and above. They are usually in the high 90s, 94, 96, high 90s at least. So if you are above 590 or 580, you are golden. So now I've spoken a lot about the exam. I've spoken a lot about how to apply and what the scores are, what the scores mean, what is a good score. Let's do a few sample questions. I just wanted to give you an idea of how these exam questions will be. In India, the way to prep for these exams was a lot of rote-based learning, meaning you mug up and vomit, you mug up and spit out. And what did you learn from that? This question, the answer is option B. That's what I learned. How do you apply that? That is a little hazy, right? And this is the one thing that I see, the difference I see from coming from even as a teacher coming from India to here. The application is pretty important, and at the end of the day, that's all we teach you. We don't tell you what the exam questions are and the answer are. No one knows that. And I'll be very honest with you. If someone knows that, go and take the class from them. If they say they are going to give you the exam questions, take the class from them. Good chance is you're going to lose your money. But if you can get that, go for it. So I don't give you the easy way out. We teach you. Our goal is not to, just help you pass the exams. Our goal, like Dr. Vinod and Dr. James said, is to teach you what is right, why this concept is right, because at the end of the day, chances are that is what will save your ass in the exam. It's not option A or option B. It's the why in those options that matter. So let's look at this question. So a patient, there's a sample question directly from their practice notes. Patient is 12 years old. Mother says the child was injured during a softball game. He was hit in the face, facial trauma, no loss of consciousness, which is good, which means there's a less chance of concussion, otherwise healthy. Complicated fracture of tooth 8 with a fracture piece retrieved. So when I say a complicated fracture, what does that mean? Any idea? If a complicated fracture of a tooth is seen, what does that mean? Can anyone give me an answer? What does a complicated fracture mean, guys? Any questions? Any idea what that means?
Pulp is involved.
Excellent.
Oh.
Enamel, dentin, and pulp, right? Enamel, dentin, and pulp. So complicated fracture of tooth 8. What is tooth number 8?
1-1.
1-1. So we are very familiar with the FDI system, right? The two-number system. But in the US, they use a universal notation system, and the universal notation system, tooth 1-1 is tooth number 8. So that means there was a pulp exposure on 1-1, avulsion of tooth number 9, and the mother has the tooth contained in a container with water, and the patient presents to office within 25 minutes. So what is the priority in this situation? How will you manage the situation? What is the first thing that you would do? Any idea? Alpha, beta, Charlie, or delta? Alpha, Bravo, Charlie, Delta. So very faintly I heard it probably D. It's probably D. What do you guys
Pre-implant.
think?
Yes.
Reimplant,
Yes.
beautiful.
Yes.
So in my endodontics, so I teach endodontics. That was my specialty, and I love the subject. So in endodontics, there is something called urgent, emergent, and immediate management. All right, immediate management is something that has to be instituted right away, ASAP. And the only one injury, dental injury, that falls under immediate management is avulsion. You have to reimplant it ASAP. So the answer here is delta. Let's look at another question here, something similar. Addition of less than 50 atomic percent of copper to gold in the production of a gold casting alloy will cause A or an. So this is again a question subject that I teach, dental biomaterials. I am a biomaterials nut. I love this subject. And does anyone have an idea? If I add 50% copper or less, say 30, 40, 50% copper or less to gold in an casting alloy, when I'm making a casting alloy, what will it do? Any idea? Alpha, Bravo, Charlie, or Delta?
Alpha.
Dr. Yamini is on point. The answer is alpha. Okay. Now, gold itself is it's very malleable. It's very ductile. If I add copper to it, its ductility actually goes down. Malleability stays the same. So this is wrong. Okay. Increase in elongation is wrong. Gold is very passivating. It is noble. So if I add something like copper with a higher EMF into it, higher electromotive potential into it, it actually decreases corrosion resistance. So this is wrong. If I add copper to gold, the primary reason for doing that is to increase the strength. So decrease in strength is wrong, which leaves us by elimination, decrease in melting temperature. Now, if you don't eliminate it and you still know the concept of how crystalline structures of metals can be disrupted by alloying, which basically reduces interatomic bond strength, which makes it easier for them to melt at lower temperatures, you would have come to the answer alpha by yourself. Again, all of this part of the biomaterials course there. Next question. Now, this is something that people people worry a lot about. Okay. This is from data research and interpretation. Again, something that I teach as part of my course. So I want you to look here. This plot depicts a relationship between diastolic blood pressure and mean pocket depth in a sample of 400 patients. Based on this plot, relationship between the diastolic blood pressure and mean pocket depth is what? Can anyone tell me what is this plot called? What plot is this? This, what this diagram that you see, what is the name for this diagram? Any idea?
Scatter plot.
Beautiful. This is one type of a scatter plot. This is not a scatter plot. This is a type of scatter plot. Excellent. Now, when I say linear, what does linear mean? What does linear mean? Come on, simple thing. I'm just asking, not data research and interpretation. Beautiful, straight along a line. So when I draw a line like this, are these spots arranged around a line or are they not arranged around a line? What do you think? When I draw a line like this, see, this is how the plot is. Okay. So there are two lines, not one line. So is it linear? Is it arranged around a single line or is it not arranged around a single axis?
Non-linear.
Beautiful. See,
Arranged
as
around
simple
a
as
single
that. You
axis.
look at this, it is not linear. because first line goes like this, then second the line goes like this. If it were linear, it would go up in a linear fashion along a straight single line axis. So is it linear or non-linear? What is the consensus here, guys? Linear or non-linear?
Non-linear.
Beautiful. Non-linear. Now, I want you to look at option A and B. I have eliminated these two options because they say linear. As good as that. So now you have two options. You have to choose between the two. Non-linear and get stronger as the diastolic pressure increases. Non-linear and weaker as the diastolic pressure increases. When I say strong or weak, okay, what does that mean? Strong or weak? It basically means what is the distance of each of this point as you go from axis X and axis Y. So how closely they are clustered. If they are very far scattered, it is weak correlation. If they are clustered close, that's a strong correlation. So tell me, where is the weak correlation here? Is it 0.1 or 0.2? Where is the data correlated weakly? 0.1 or 0.2?
2.2.
0.2.
Weakly, I'm talking weakly. When I
One.
say weakly, it is scattered. When I'm saying strong, it is clustered close to each other. So again, where is it clustered close to each other?
0.1.
Close to each other.
0.2.
0.2.
Two.
So this is strong and this becomes weak. Okay, so we know that it is non-linear. At this point, it is weak, and here it is strong. So this is the pocket depth. This is increasing pocket depth. This is increasing diastolic pressure. So if the diastolic pressure increases, as the diastolic pressure is increasing, as you're going towards this end, okay, is the correlation getting stronger or weaker?
Stronger.
Beautiful. It's getting stronger. So what is the answer now?
Option C.
Beautiful. See, it's as simple as that. Even if you don't know biostatistics, 5 minutes of this and you are able to answer this. It's as simple as that. So what I want you to keep in mind is, yes, biostatistics, data research and interpretation it's a mental stumbling block. People think that it is something out of this world. It is not. It is simple. It's just comprehension. Okay. And we teach you that. We teach you how to break down and demystify these questions and concepts. Now, these are the links for the ADAT. I just wanted to give you these links. These are not my links, by the way. Everything is available online. These are from the ADAT's website. And I would highly, highly recommend reading this admissions ADAT candidate guide. This is where I actually drew all of my slides and statistics from. So I would highly recommend reading this. It's available. If you Google ADAT candidate guide 2024, you'll get it. Now, why should you take our course, right? People say, oh, ADAT is easy. Go take up just read a little bit online. You can study on YouTube. Why do you want to pay 4,000? Yep, that is a solid question that you should be asking anytime you're putting money, because at the end of the day, money is important. I'm not saying that, you should throw money around. Money is important. Coming from as an immigrant out here, each penny matters. And I was in your shoes. I get it. I absolutely agree. So why should you take up a course? Because at the end of the day, money matters. Remember what I told you? Which route should you choose? Whichever route you should get, you get into dentistry faster. That's the one you choose. So, yep, you can go ahead, take your chances, take up the exam on your own. You may score well, you may not, right? If you don't score well, that means you'll have to come back and take up this exam, meaning you'll lose a year. So if you do join our class, we don't guarantee that you will always score well, but we will give you everything that you need to make sure that you score well. So we are maximizing your chances at scoring well. At the end of the day, you might end up saving, how much amount, based on 1 year, saving 1 year, about 125,000. So is this course worth 125,000? I'd say yes. So this is how I look at any business opportunities. I look at what is the time cost factor. Yes, I can, when I'm doing DIY projects around the house, can I paint the house myself? Absolutely. You can go on YouTube, you can learn how to paint yourself. There is no reason why you shouldn't, right? You can do that. How long will I spend painting a room? Maybe 8 hours to a day. If I take a day off or put that same day into working, guess how much I'll earn? Is that not worth paying $300 to $500 for someone to actually come and paint my house? Heck yeah. This is how I look at when I should spend money to do something or do it myself. So that's what I tell you. You have to do this, thought process yourself. You have to do this calculation yourself and see what makes sense. But for most people, the class makes sense. The reason why we actually don't, you can read everything there is, but you'll just spend a lot more time. We tell you exactly what you need to read. We are like a digest. We are we are a resource between the four of us. We have about 30 to 40 years of teaching experience. And we actually can give you the concise materials that you need to study for this. So we have about 100 hours of only ADAT focused live learning. Apart from AFK, it's 100 hours only for ADAT, which is something that no course offers. We're focused on biomedical sciences, clinical sciences, and case-based discussion with biostatistics. We have study materials for you, specific books that you need, everything that you want, we will provide. And we have these practice tests. We have about 15 or plus tests that you can practice on, subject-wise tests, mock tests, all of them. We have mock exams with discussion that we will actually do live for you all. And again, all of these classes are recorded. So after the live, class, you can always go back and view the recording. So we give you the best of both worlds. Now I'm going to talk briefly about dental school seats and admissions, because this always comes up. Okay. Dental schools, what do they look for? So for a student to be called for an interview, or for a student to be a good candidate, you need a strong student profile. How do you get a strong student profile, you ask me? There are three things that they look for. Okay. The first is your exam scores, AFK and ADAT. So we are right here now. Okay. We are right here. We discussed AFK, ADAT, all of this was only one part of this Venn diagram, of this triangle. Okay. Now, something that has already passed by and you can't change is your GPA. Okay. So GPA is basically your grade point average, your average of your 4 years of your performance at dental school in India, Middle East, wherever you're from. Okay. Now, based on the university, some universities are very lenient in scoring. Some universities are very strict in scoring. So you might actually go to a university like Rajiv Gandhi University of Health Sciences, which was, when I went to it, it was one of the strictest universities in terms of scoring. So 4 years before I went to dental school, the average dental average score of all 4 years combined of the university topper, and mind you, there were about 45 schools in the university. So of all the 45 schools, of all the students who took up, the person who topped all of these exams all 5 years, the average score was 68. It is a very low scoring university. So when I went to dental school, I'm not trying to brag, but when I went to dental school, I had an average score of 78. All 4 years, 78. I was the university topper. I had distinctions all 4 years. And my score average all 4 years was 78. Fast forward 5 years after, the average score of a university topper there is about 81. So it increases slowly. But then there were other universities which I'm not saying that were, took the easy way out, but they were more lenient. The average scores in, early 2000s there itself was about 72. So each university has its own way of giving you a score. And what ECE does is they beautifully take that, look at the university leniency, look at the university ranking in their opinion, and based on the year that you graduated from, give you a GPA. So your GPA is equivalent to whoever took up exams in the US and got certain GPA. So I had a perfect GPA, 4.0. When I applied for dental schools, I got my EC evaluation. I had a perfect GPA. My wife, she had the same. Okay. Our percentages, they differed by about 3%. That's all. Now, this is something that you can't change. This is something that, well, for me at least, is about 15 years in the past. I can't change it, right? So what do we do now? Now we focus on what we have. So this is the past. This is something that you already have. So if you have a good GPA, that is good. If you have a poor GPA, how do you make the student profile strong? Answer: focus on ADAT. You have to put more focus on ADAT. So for someone who has a strong GPA, maybe a score of 580 of ADAT is enough. For someone who has a poor GPA, maybe they have to score 600 in ADAT to get a strong profile. So this is how you, boost up your profile. And the third thing that you still have in your hand in the present is your IELTS and TOEFL score. Very, very highly underrated, but this is a very important part of your profile. People think, oh, it's an English exam. All right. They say 6.5 is enough. 6.5. I have 7. 7 is more than enough. It's more than what they have on their website. So it's just like when you apply to a school, bare minimum AFK score that you needed to have was 75. Does that mean 75 or 76 or 77 would give you a call, or you would need a higher score? Honestly, higher the better, right? So IELTS and TOEFL is something that people forget about. This is something that you have to focus on after you actually work on your ADAT and AFK. So this is the first priority. After this comes this, because you want to make sure you get your ducks in a row. And honestly, again, not trying to brag, but I'll give you my IELTS score. I scored a 9.0. So 9.0 in listening, 9.0 in reading, 9.0 in speaking, and 8.5 in writing. So overall score was that high. There are candidates with this same exact score taking up this exam, applying to dental schools right now. I'm not saying I'm the only one. There are many candidates with this score. So if you want to, fight with the best, if you want to go toe to toe with the best, you have to put, war footing preparation into TOEFL as well, or TOEFL or IELTS. You have to prep for it just like you're prepping for your AFK exams. But this comes after. Okay, I want to tell you this again. This comes after you've gotten a good AFK score. How long do you need for the AFK or ADAT? People say anywhere between 6 months to a year. So this is how long you need to prep for this. How long do you need to prep for this? About 1 month. I'll tell you, with 1 month's preparation, you'll get a great score. What are the total number of DDS seats that are there, and what are the total number of universities that take up either ADAT or AFK? So if you look here, this is the entire scenario, and of the 86 seats, 2 universities, they take up AFK as the entrance exams. Again, this is bound to change. As of now, this is the data which we have, but they might decide and say, you know what, we're not taking AFK, we're taking ADAT. So that might change as well. So of the total 86 spots, ADAT, if you take only ADAT, you get 60 spots. If you take up only AFK, you are eligible for 26 spots. But then if you take up ADAT and AFK, you are eligible for a total 86 spots. Now, how many people apply for this? Round about 1,000. So 1,000 people every year applying for about 86 spots. Competition's pretty high, right? So only 1 in 10, less than 1 in 10 will get into dental school. But here's what I tell you, go step by step. Okay, and don't look at this. Keep this big picture in mind, but that big picture should not be there to discourage you. It should be there to spur you on. All right. So when I took up this exam, when I took up recertification, there were 24 seats at the University of Toronto. I knew that I wanted to go to UFT. That's it. I wanted to study there. End of discussion. Because they had 24 seats. My wife and I, we applied together. We wanted to get into the same dental school together because my wife and I studied dentistry in India together. We studied grad school. She was an orthodontist, I was an endodontist. We studied that together. And we wanted to go to dental school here together. Sucker for punishment, right? That is how we are. But we looked at UFT, 24 seats, and we didn't say that it's only 24 seats and about 200 people are applying. We said there are 24 seats. There are 2 seats for us and 22 seats for the rest of the people. That's how you look at it and prepare it. You have to have that confidence. And this is, I'll be honest, fake it till you make it. You have to have that level of confidence to pump yourself up, because there are ample people to bring you down. The only person to pump yourself up is yourself. So how do we apply to the university? First step, you apply with your ADAT and AFK scores. So you are actually before this step. So you haven't gotten your ADAT and AFK scores. I'm just giving you a primer of what to expect. Apply to the universities with your ADAT and AFK score. Your ADAT, AFK score, your IELTS score, all of this will give you a chance. Okay, I'm again specifying this. So this will give you a chance to get a call. This doesn't mean that you're accepted at university. If you got a 580 or 620 or 700, doesn't mean you are in university. It means you get a chance. You have a foot in the door to get in. Now, after that, sometimes they have a bench test. Sometimes they have only a university interview, and sometimes they have both. So we prep students for all of these scenarios. So we have a very, very good bench test prep tutorial in DSTC. We also, Dr. Abhishek and I, we take interview preps. So we teach what to do, what not to do, how to have a good interview when you're applying. So all of this, we are basically a one-stop shop for your certification, as simple as that. So we will give you the guidance based on what stage you are. And as of now, you are here. You are here. All right. So we will focus more in this course. Yes, it's good to have an idea of what is the final picture, but in this course, I would actually encourage questions on ADAT and AFK, because you will get questions, you will have doubts about the next step, but that is for a later date. It's hard, but I want you to keep that for a later date. Now, this part, again, I'm just putting this out there. This is what's there for dental specialists. But again, we're not going to focus on this, because if you thought AFK and ADAT was hard, well, forget about this. This is very, very minuscule. This is not really a fighting chance either. All right. I'll be honest with you. Most of the schools don't have a consistent DSCKE input. DSCKE is basically a 1-year equivalency program that you go to schools, just like an IDAP or ITD program that you do for DDS. This is a 1-year specialty program. There are, from my my knowledge, there are only 2 universities that actually even look at this. One is U of T and this other is British Columbia. And of the 2, U of T is unreliable. Sometimes they take 1 candidate per year. Sometimes they take 1 candidate every 3 years. As in the past couple of years, they didn't take anyone. And now they took 1 or 2 candidates in prostho and ortho. So it's very, very difficult to apply. And for people with dual degrees, like conservative dentistry and endodontics, oral medicine and radiology, even oral maxillofacial surgery, I'll tell you outright, I have actually, this is coming from personal experience. This is from the horse's mouth, so as to speak. I emailed NDEB to see if I was, if I could apply, but they said because my degree was conservative dentistry and endodontics. Here's the clincher. I'm not eligible for either restorative dentistry masters or endodontics masters, neither. So it's basically a lost cause for me. And also, if you want to do your masters, more power to you. You can always do your masters after getting licensed or after going to dental school doing a DDS. The chances of you getting into a master's program are higher if you have a DDS from that same school. So if you have a UFT DDS, UFT is more likely to take you into their master's programs. But then again, it's 3 years. And I'll be very honest to you. The return on investment, it's just not there. So I'm an endodontist. Even though I'm not licensed as an endodontist here, I can do endo with the best. I don't need to have a master's program to only do endo. In my practice, in one of the practices that I work at, I only do endo. My practice is limited to endodontics. I only do the difficult cases that people don't want to do, just like what an endodontist does. And I charge for that. I don't charge simple fees. I charge complicated endo fees. So you can do that if you have training. If you've done only implants, your training was in oral surgery, you only want to do implants, get license, even direct licensing. You can still do only implants without doing a master's. If your idea, your focus is, I want to do a master's so that I will be able to do certain clinical dentistry, well, if you know it already, you can do it. The world's your oyster. You can do ortho. My wife does ortho because she was an orthodontist, and she does ortho without a ortho master's degree here. She does an ortho as a DDS, which is completely acceptable. You should know your limits. You should know when to refer, and you should be able to do the treatment at the same level as a specialist, because that's what they will take into account. Now, final thoughts here about how to reach out to us when you have any questions. Please take down this information, dstcinstructor@gmail.com. This is our email ID. This would be monitored by all 4 instructors, all 5 actually. We have another instructor coming in for you for biomedical sciences. So we have this email ID being monitored by all 5 instructors. If you have questions about ADAT, AFK, the actual subjects, reach out to the instructors. If you have questions about administrative concerns, about your fee payment schedule, about your notes, if you have not received your notes, you want to get notes, you want a printed copy, or if you lost access to something in the drive, reach out to Mr. Naresh or Dr. Manmeet. So you have their email IDs there, you have their phone numbers there. So please make sure you reach out to us with the proper questions. So if you ask me, oh, I don't have my notes, I can't help you. I'm not admin. But if you ask Dr. Manmeet, he'll be able to help you with that. If you ask Dr. Manmeet, I have a doubt in this question, he'll forward that question to me and I'll answer it, right? So always it's better to ask the correct person. So if you have any questions about the subject matter, this is where we go to. If you have any questions about administration, administrative concerns, for any queries regarding subjects, university applications, say I have not received my notes, anything like that, right? Mr. Naresh or Dr. Manmeet. Now, I know I spoke about a lot of things which were in, some people might feel that they're not very encouraging. I wanted to leave you with this picture. So does anyone recognize this skyline? Which city is this? Any idea? Any idea what we're looking at here?
Toronto.
Downtown Toronto. This is downtown Toronto. So this picture was in January 2017. I was in Mississauga for all of 2 months. I landed in December 2016. So I went down to the waterfront in Mississauga. There's a park called Jack Darling Park, and I took a picture from there, looking over the Lake Ontario, looking at Toronto. You can see it was very cloudy because it was winter. It wasn't very it wasn't very great. It was gray. Winters, if you've not experienced winters in Canada, monotone, grayscale, or sepia, this is the best way to describe it. Okay, it's gray, it is dull, especially in some areas, but there's beauty in it. Okay, so this photo I took right across from the water. This was Toronto. This is about 35 kilometers away. I had a great camera, by the way. So I wanted to put this photo out there because this photo is when I was in your shoes. Trust me, all of the instructors here, everyone has been in your shoes. We're exactly where you were at this point in your life. Okay, we were new to this country, we didn't know what to do. Our degree meant jack shit. You had to start from scratch. You have to work as a IT tech support consultant, or a worker in a warehouse, or a dental assistant, or a guard, a security guard. You have to make ends meet. You have to pay for classes. Your savings are evaporating at a mysterious rate. Okay, but we came from the same spot that you are. This is my snapshot in time. All right, at when I was in your shoes. I just wanted to leave you there with this picture because I want to tell you difficult roads lead to beautiful destinations. Yes, it was difficult for me. I'm not going to sugarcoat it. It took a lot of blood, sweat, and tears, right? Blood, literally, because I've hurt myself working these kind of menial jobs. I hurt my knee, I hurt my leg, literally bled while I was working at a warehouse. All right. A lot of blood, sweat, and tears to bring me where I am. Right now, I am very comfortably settled. I have a huge house in a very quiet locality. My family is settled. I have well, the perfect American dream, like a dog, 2 cars, a motorcycle, whatever you want for what you would dream of, right? And I have a lot of free time to pursue what I want to do. This all came from a 5-year period of working my ass off. Okay. And the only reason why I'm here now is you never drop the ball. You never let eyes off that goal. It is difficult. I'm not going to sugarcoat it. You are going to, many times, not just once, you're going to many times regret your decision. You're going to say, why the hell am I doing this? When you're working in a warehouse, you're lifting these heavy auto parts and, packaging them. You're going to say, why did I do this? Is this why I came to the country to do this? I was a doctor. I had servants at my place. I was comfortably settled. The answer is it will pay off. And there are many people to bring you down. I'm going to tell you this again. There are many people who say, oh, you've only done one preparation. I've done 3 times. I've done preparation 4 times. I've gotten this. Oh, you only have a 580. I have a 570, 620 score. I have this score. So people will always be there to bring you down. Right? Don't worry about it. You're the only person who can push yourself up. So eyes on the prize. All right. Keep in mind, difficult roads lead to beautiful destinations. All right, guys. So with this, I will stop my presentation. Dr. James, Dr. Vinod, are we taking any questions now? Dr. James and Dr. Vinod? Guys, if you have any questions, put your hands up, put your, the thumbs up sign. I'll get to you one at a time. I'll moderate this. Dr. Karanjot has a question. Again, other people who have questions, please put your hands up. Don't open your mics right away. Keep your hands up and I will pick on each one of you and I'll make sure the questions are answered. Dr. Karanjot, you had a question there. You can go ahead, unmute and ask the question.
Yes, sir. Good evening, sir.
Good evening, Dr. Karanjot.
Yes, sir. Sir, actually, I have a question. Like, I have gone through the whole course for AFK. Currently, like, I am not able to, I'm not giving the test right now in August because my registration wasn't done. My registration just got approved later on. So, like, do I have to go through classes again? Like, I do have recording.
So for this, I will let Dr. Vinod, I think, do you want to answer this?
Sagar, I think Vinod is offline. So
Okay.
he's not here.
Okay. So Dr. Karanjot, when did you take up the course?
The whole course I have gone through it. The previous classes I have like taken. Till on 2nd of July, we have ended the session. Like the last session was over there.
Not too
Recently.
long ago. So why
No.
did you not decide to take up the exams this time?
Sir, actually my registration came later on.
Okay, gotcha. Are you looking at AFK ADAT or only one specific exam?
Both of the exams. Like
Okay.
first target was AFK only, then afterwards the ADAT. So
Okay.
I've opted for both the courses. Yeah.
Did you take up the ADAT module completely in its entirety?
No, I haven't. I was asked to take the online, like I was taking online classes. So I just wanted to take in class from in January. I thought like Naresh ji have told me that live classes will be going from January. So therefore, for ADAT I haven't done. Like for AFK, I have gone through the whole modules.
So what I can suggest, see the AFK, the entire thing that you've done, right? That is, like I said, the clinical sciences aspect of ADAT exam. For the ADAT specific part, you still have to take the classes like for data research and interpretation, biomedical sciences.
Yes.
So
Yes,
for
yes.
the best thing, I don't want to give you the wrong information. Best thing I can suggest is speak to Mr. Naresh or Dr. Manmeet, and they will be able to tell you. I'd suggest doing this offline, calling them and speaking with them, and they'll be able to guide you what your next step should be.
Okay. So like I have gone through like whole session. I'm like well confident in that. Like I really attended the classes with full focus. So I really don't think so I need it. So
So
they will
see,
be the
at the
right
end of the day,
person. Yeah.
you'll be your best guy, judge, right? So you'll know exactly what your level of prep is. So my suggestion, speak to them, do take up the tests so that you have an idea of how to evaluate yourself, whether your evaluation is correct, is there any area lacunae in your knowledge. So
Okay.
speak to them, take up the tests, and then take up the exam.
Okay, so my ADAT classes are pending, so I will be taking them on this schedule only, or like when they will be starting, I have to join over there.
So they are interspersed. It's like ADAT, AFK, all of them, they're interspersed. So that's why this question, I would leave it for Dr. Manmeet. He'll be able to answer the best.
Okay, okay. Thank you so much, sir.
No worries. Dr.
Okay.
Gurjinder Singh, you had a question there?
Hi, Doctor.
Hello. Yeah, please go ahead.
Yeah, so my question is like my only focus is on AFK. So,
Okay.
so how this course would be like only for AFK, because I don't want to, get myself overwhelmed with AFK that like all of the things if it's gonna make so far like notes purpose as well as classes. So it would be like, because my focus is only on AFK. So how it will work out for me?
So this course is for AFK and ADAT altogether. Like I said, it's interspersed. It's a one single course. Whether you're taking up only AFK or only ADAT, right? We will guide you the same way, because at the end of the day, it's not radically different. It's the exact same thing. Dentistry is dentistry. They can't make up new things and ask you that for the ADAT or the AFK exam, right? So this course is just one single course for this very reason, that you are going to take up the AFK or ADAT exam. But specifically, again, this is an administrative concern on how or which classes to attend, which classes you can skip, right? Speak to Dr. Manmeet. He'll be able to tell you. Okay. And have you received the schedule for this class?
Yeah.
Okay, so in that schedule, you'll see those questions, those subjects specifically staked out, which subjects are, more relevant to ADAT. Those subjects, you can look at marking those dates out, and then you can decide whether you want to take those classes or not. But at the end of the day, this is one single course. It's for AFK and ADAT. Okay, so speak to Dr. Manmeet. He'll be able to help you with that.
Okay.
So, no worries. Dr. Surabhi, you had a question there?
Hello, doctor.
Hi, doctor. Please go ahead.
I have a question that like if we give ADAT in 2025,